This is Greenacres Care Home. It's a residential home for older people on the outskirts of a small town. The home houses 60 residents who are looked after by a team of dedicated care workers. Greenacres started using the Docabo NHS-approved remote monitoring solution several months ago. Its integrated care board funded an opportunity to enhance care with the use of technology. The service directly connects the home to a clinical hub of healthcare professionals who monitor the residents virtually. This is called remote monitoring, virtual care, or may also be known as telehealth. It's a safe and efficient way for individuals to receive care virtually. Here's how it works. The care home completes some simple questions about residents on their tablet or mobile phone. This data is sent via a secure clinical database to be monitored by a clinical hub or the GP, depending on the model being used. A clinician can respond directly to the care home or through the secure database. If access to further primary or acute services is required, the hub or GP can action this, as well as safely sharing relevant and necessary data with the additional service providers. This means that virtual care complements face-to-face interactions and increases access to primary care services for both residential and nursing homes. Virtual care pathways are a group of questions requiring physiological and symptomatic data to be sent to the monitoring clinician for a specific purpose. Care homes may use differing virtual care pathways, such as pre- and post-falls, but will typically adopt 3 main pathways, which are the monthly wellness check. Each month, a carer completes these questions with a resident to monitor their baseline measurements. The deteriorating resident, or my resident is unwell. This is completed when a resident is feeling unwell or demonstrating signs of deterioration. The virtual ward round. This pathway highlights specific needs to be reviewed at ward round with the resident's GP. This is Ayesha. She's a senior care worker at Greenacres. This is Sandra. She's a resident. Ayesha is concerned about Sandra because she seems a little different and more lethargic than usual. There doesn't appear to be anything significant to justify this concern. Sandra reports that she has a headache but is otherwise feeling okay. Yet, Ayesha has a gut feeling. With Sandra's consent, Ayesha decides to complete the deteriorating resident pathway on the Docabo system. Ayesha takes some physical observations along with some symptomatic ones, which are all entered onto the tablet. Ayesha knows that a clinician is monitoring the results and will contact her if there are any anomalies. Prior to using remote monitoring, Ayesha may have spent a significant amount of time trying to contact the GP by phone and would have been unsure how to communicate her concerns effectively when they were based on a gut feeling. For this reason, she may not have contacted the GP this early, instead choosing to monitor Sandra more closely to see if symptoms increased prior to contacting the GP. However, with remote monitoring, she was able to complete a meaningful intervention with Sandra to better investigate her health and did not need to spend any time attempting to contact a GP, so was able to spend more quality time with Sandra, which she appreciated. A short time later, Ayesha receives a call from Mary, a nurse who was monitoring Sandra's measurements. Mary explains that Sandra's blood pressure is a little higher than usual, and this may be causing her headache. She was able to review previous entries of Sandra's blood pressure from when it was submitted in the monthly wellness checks, which showed that Sandra's blood pressure had been gradually elevating over a period of time. Mary advises that although there is no immediate concern, Ayesha should submit Sandra to be reviewed in the virtual ward round with her GP. The next day, Dr. Chickaroon was completing his virtual ward round. He was immediately able to view yesterday's interactions, as well as review all previous observations, which demonstrated that Sandra had an increased risk of heart attack or stroke. Dr. Chickaroon was happy as, prior to remote monitoring, this observation may have gone unnoticed until it became more significant. He was also happy that all relevant observations had been collected through questions, so he was able to review Sandra within minutes. And, although he chose not to change her medication, he gave some advice that may help reduce her blood pressure and agreed on a care plan to monitor this. Early identification and relevant health promotion advice significantly reduced the risk to Sandra and may have prevented further escalation of her symptoms. The effective use of remote monitoring and good care provision can benefit the care home and the wider health system. Such benefits include offering more integrated and personalised care, which offers a positive impact on the health of residents. It can reduce the number of emergency call-outs within the care home, which improves quality of life for the residents and gives them and their families peace of mind, helps to upskill the workforce, and reduces health inequalities. All of which supports the Enhanced Care in Care Homes policy and can improve CQC ratings. Ayesha was pleased that she was able to access timely clinical support and offer the best quality of care to Sandra. Both Sandra and Sandra's family were happy that she was being looked after so well. Talk to Dokabo about how you can use remote monitoring in your care home and reap the benefits like Green Acres Care Home.